Okay, but when we are talking about fluid compartments, we also consider a special fluid compartment known as total blood volume. You might be thinking that we have already considered the plasma which is flowing in the blood vessels, right? But here when we talk about blood, it consists of plasma plus the cellular elements of the blood, that is the RBCs, WBCs and platelets. But why are we considering it separate? As because it has special functions and it is flowing in separate compartment, that is the circulatory compartment. So this constitutes 7% of the body weight. Logical also, isn't it? We said that plasma is 5% of body weight, and when we add the cellular components into it, it will be more. So it is 7% of the body weight. So it constitutes of 60% of plasma and 40% of the RBCs. There are other cells also, but their number is very less. So majorly we consider RBCs only when we are talking about the total blood volume. So other cells will constitute very less amount of this total blood volume. Now, what is the ionic composition of various body fluid compartments? So majorly we have to see the differences between extracellular fluid and intracellular fluid. See, here we are not considering the differences in the compartments of extracellular fluid only, that is the interstitial space and plasma, because these ions can freely move in between these spaces, right? So what are the differences and some similarities between ECF and ICF? Well, osmolality, if you see, it is almost same. So it is around 290 milliosmoles per liter. Then sodium. Sodium is a major cation of extracellular fluid. So the concentration here is 145 millimoles per liter. While you see in ICF, it is only 12 millimoles per liter. Potassium, on the other hand, is the major cation of intracellular fluid. Then chloride. Chloride is the major anion of extracellular fluid with a concentration of 110 millimoles per liter. Then phosphate. Phosphate is the major anion of intracellular fluid. Bicarbonate is present both in ECF and ICF, but it is one of the major buffers of extracellular fluid. Proteins again are present both in ECF and ICF, but they are very high in concentration in intracellular fluid. And if you see that depending on these concentrations, you see bicarbonate is more in ECF and proteins is more in ICF. These bicarbonate act as very good buffers in ECF, while proteins act as very good buffer in ICF. But this is quite of understatement because these proteins which are present in ECF, especially hemoglobin, that also act as buffers. Plus there are other buffers in ICF. Then pH, the extracellular fluid pH is little bit towards alkaline side, that is 7.35 and 7.45, while intracellular fluid pH is little lesser, that is 7.1. So the major points to take from this is sodium is the major cation of ECF, then chloride and bicarbonate are the major anion of ECF, while in ICF major cation is potassium and the major anion is in phosphate. Okay. So now how these various body fluid compartments are measured? Well, for the measurement of body fluid compartments, we use the dilution principle and the principle of conservation of mass. So let's try to understand this. See, what we do is we use a substance known as an indicator and we have a particular mass of the substance, known mass. So let's call it mass A. Now we dilute this substance in a particular volume, let's call it volume A. When this substance equilibrates in this particular volume, it will achieve a concentration, that is concentration A. Now we know that mass A is equal to volume A into concentration A. This is a fundamental principle. And all these three values we already know because we have only given a particular mass into a particular volume and this concentration we can determine. We can take a sample of this, use it in the lab and determine the concentration. Now what we do is we add this into another volume which we have to determine. We don't know this volume. So when we add it, what happens that this particular indicator will distribute in this volume and it will achieve a new concentration. So volume is more, the concentration will be less. Alright. And we have to assume that obviously after adding this particular volume, there will be negligible change in the unknown volume. So this added volume has to be very, very less. Fine. Now if the mass which we are using is it is neither metabolized nor excreted, what will happen? Mass A will be equal to mass B. That is the principle of conservation of mass, right? So indicator has diluted in the new volume, that is the dilution principle, and the mass is remaining constant. So that is the principle of conservation of mass. So we can say that mass B is equal to volume B into concentration B. So with this we can also say that mass A is equal to mass B. Mass A is equal to mass B. Hence we can say volume A into concentration A is equal to volume B into concentration B. So this, what is this? Mass A is equal to mass B. This is the conservation of mass. On the other hand, this particular indicator is getting diluted in the different volume. So that is dilution principle. So both we are following for determination of the body fluid compartments. So now you see that we already know mass A because we have only added to a known volume, and a concentration also we can take out a sample and measure. So all these we already know, right? So we know already VA and CA, and the concentration which it achieves after we add into the unknown volume, that also we can take out a sample and measure the concentration in the laboratory. So we will know CB also. So by this formula, by filling in the values of VA, CA and CB, we can determine what is the volume of the unknown compartment. Okay, fine.